Am I audible, Amro?
Am I audible?
Yes, now you're audible.
Okay. I think we're going to start now. So thank you very much, all of you, for joining us. I would like to introduce you to Dr. Iman Babiker. She is our program leader in healthcare management. She has been in healthcare for years and years. She has been in multiple institutions and multiple universities all around. And at this stage, I would like to leave the floor with her. Dr. Iman, thank you very much for joining us. Please go ahead.
Thank you. Thank you very much, Amr, for introducing me. Hello, everyone. I hope everyone can see the screen. My name is Dr. Iman. I am a lecturer and the program leader for healthcare management at GBS Dubai. I would like to welcome you all and thank you all for joining and being here on time. Please bear with me. We're going to have a lovely session. Today we are going to speak more about the career in healthcare sectors, and especially when we talk about healthcare sector, I'll speak more about the things that I have the passion for, that I think I'm actually leading now at GBS. It's healthcare management. How's the healthcare management sector is going now? What is the trendy? What is the growth of the market, especially when it comes to jobs related to healthcare management? What are the opportunities that you can have? Maybe we'll speak a bit about the different job descriptions and job titles that you may have after completion of our certificate and diploma. We are going to speak a little bit about the program also, and we can dive more about the responsibilities, duties, and the things that you can do and explore in healthcare management. So in general, I'm going to speak about healthcare sector and healthcare management particularly, and that will include different aspects. I hope that you enjoy the session. Starting first, let's talk first about the healthcare sector in general. So let's take a general definition for that. Healthcare sector in general, it's the provision of medical services. Actually, we need to maintain and improve people's health. That includes prevention, diagnosis, treatment, and recovery. So everyone got sick in their life, definitely 100%. Everyone got sick in their life. So once you get sick, you go through this kind of process of, first of all, you don't know what's wrong with you. So this is now we have to find out what's wrong with you. But before that, we go for the prevention. Like we have some measurements and some things that we need to do to prevent ourselves from illness or injury. It's not necessary to be a disease or like an illness, or it could be also some kind of injury, like you just fell down and you just cut your head or your hand or you start bleeding. So there's two, illness and injury. It starts with the prevention. Let's keep away from that first. Let's be careful and not get injured. First of all, this is the prevention. The illness prevention could be just like, for example, being healthy, having vaccinations, taking some kind of medications or drugs to help you for the prevention. So first starts with the prevention. And then if it happens, and whatever an illness or disease or injury happens to you, now we have to go for the other level, which is a diagnose. Let's know what's wrong with you. Diagnose means let's understand and see what's wrong with you. We have to know what happened to you. And then once we know what happened to you, which can be from some kind of imaging, medical imaging, it could be by lab tests, taking some blood or some urine from you or any fluids from the body and taking samples from tissues, and to understand what's wrong, what is not normal, we call this a diagnose. And then we go for the next step, which is the treatment. Okay, now we know what's wrong with you, we know why this happened, let's get you into a treatment plan, or we call it a treatment a management for this disease and plan. Now we have a treatment. This treatment could be drugs, medicines, it could be a surgery, it could be physical therapy, different kind of treatments, or it could be psychological, mental therapy. So all of these can go to the treatment. After you get in your treatment, you go to the next level, which is a recovery. And this is how the cycle goes. After you finish that, you go to recover, and hopefully you get healthy and go back. So the whole process of healthcare, it's actually maintaining your health. If things bad happen to you or not, starting with the prevention, diagnose, treatment, and recovery from illness and injury. All of these comes under the word health care, means taking care of health, maintaining that the people have the best health actually. So this is a general term of healthcare, and healthcare sector, it's a very, very big, wide sector. You can start it, first of all, let's talk about the healthcare facilities, hospitals, clinic, medical centers, small diagnostic centers, labs, and then we have physical therapies, and then we have psychological, mental health. There's so many things that are going in there. And if we start talking about health sectors, we won't finish in 1 hour, believe me. But I want to speak more and dive into health sector, especially to the one that I just mentioned to you, that we have management for that. Who is taking care of all of this process? It's actually the healthcare management. The healthcare sector, it's a very big industry, and it's not just an industry, to be honest. It's calling the noble profession, because we are talking about human and humanity here. We are saving, literally, we are improving and saving lives of individuals and community. And it's not just related to people. This is for the whole community. If we have a healthy person, if people are healthy, community is healthy, the whole nation is healthy, and so on. So this is a big, noble profession, and it's actually where we have to provide primary care and giving a lot of insights, not just for taking care of people and their health, but because in the healthcare sector, everything based also on the research, which is a very important term. Everyone have to understand that in healthcare, we do a lot of research. You will not believe what happened and how you get a medicine to your hand. Like, if let's take a small example, Panadol. How did they actually come up with the Panadol, or any drug, any kind of drug? How did they come up with that? Actually, there is a huge process behind that, and they are all based on the research. They did a lot of research during out all of it. Takes a lot of years actually to come up with something. So it's not just a drug. I'm just giving as example as Panadol as a medicine. It could be medicine, it could be surgeries, it could be different techniques on how to save lives or how to maintain health. So this is a general definition of healthcare, and I will go to the special thing that I really, really like and enjoy. It's healthcare management. So what is healthcare management? If you go back to that case of the patient goes in, have the prevention, diagnose, treatment, and the after recovery, who is actually managing all of these process? Guess what? Healthcare management sector does that. Who's managing the hospital? Who's taking care of everyone in the hospital? Starting from coming in, admissions, appointments, going first station to the nurse, and then to the physician or the doctor, and then the doctor will send you to lab tests. Who's doing the lab tests? Who's maintaining all of this dynamic? Who is maintaining all of this journey and process? It's healthcare management. And it's related more to the effort of involving everyone in there in planning, directing, coordinating for the non-clinical activities. This is an important term that I need everyone also to understand, that in healthcare management, this is the management. This is not the rule actually of having a clinical activities with patient. So you're not actually doing a surgery. The surgery is being done by the doctor or the surgeon, right? But in healthcare management, you as a manager, you are going to plan for that surgery. You are going to plan for the clinic or coordinate the whole process from the beginning to the end. It could be part of your job also as in healthcare management. It also encompasses various aspects of so many other things, not just related to patient, but it's also related to finance and operations of that facility, human resources, HR, who are you recruiting to your place, and the strategies of planning within the healthcare. Also, we are directly related to quality assurance and policy development systems and different systems of healthcare. To be honest, the list, it will never end. Like, there is a long list of the things that can be done in healthcare management. It's one of the strongest actually aspects and sectors of healthcare sector, and it's been trendy and growing for the last it's in the last 10-20 years. And I got you some industry trends and some of the facts that you may relate to, and if you just took a look on that, you will understand what's the meaning of the trend and the expansion of healthcare management, especially now. And we will speak about this now because I want to go back to you later. In the next slide, I'll take you back on the time of COVID and what happened and why healthcare have been one of the most important sectors all over the world. I gave here some examples for some of the let's say statistics and reports that have been reported by the WHO. Based on the WHO, this is for the Gulf countries. If you see here for the GCC countries, we have some numbers. GCC countries, I mean Qatar, Oman, Saudi Arabia, Kuwait, Bahrain. So we are taking them among this region because now you know that we are located here in Dubai and the UAE. So let's take the trend and see how is the growth based on the WHO, according to them, and in their report for they have a report up to the 2020. So they do report every 2 years, of every 4 years, in 2016 to 2020, and from 2020 to 2024, we are still waiting now for the 2024 report. There was a growth. You can see an exponential growth from 2016 to 2020, which is 5.8 percentage. This is actually a big, a big raise and change from 2016 to 2020. And you see here based on the industry, so 5.8 increase in the income and the currency of the sector of healthcare. That's a big one actually. And you will see here in the other one, the one on the right here, that the current healthcare expenditure in different countries. You will see that in Saudi Arabia got more expansion and explosion for 4.3%. You will see also in the UAE 12.3, 6.6 for Kuwait, 2% for Qatar, 5.2 for Oman, and for Bahrain it was less by -2%. You will see that in the UAE and Saudi Arabia there was a huge actually expansion. The highest actually came to the UAE. So in the UAE, healthcare sectors in general and healthcare management have a huge expansion, and it's very trendy here in the UAE to be in the healthcare sector. It's promising. If you can imagine, from 2016 and 2020, it got a rise of 5.8 and 12.3 in the UAE. Imagine how the numbers will be here. I really can't wait to see the new reports in 2024. And I hope I can have another session with you so I can share the new updates of this year. This is something I think also anyone who is interested in being in the healthcare sector, especially when we speak also about healthcare management, they will be very interested to see that, of course, if I want to be in this sector, I need to understand how is the future trending will be, and I need to understand if I work in healthcare sector, what is the average income will be or salaries. I am taking this actually from one of the reports we have the Mitchell page. They gave this report in 2023, and unfortunately I couldn't get the one from 2024. They're not published yet, but based on the last year, just take a look for all of the occupations here, and you will see that luckily the highest is for health and medical. So healthcare sector is actually one of the highest average. I'm talking about average, so no one give me like insights about I'm talking about average about all the healthcare sectors, including everything here. And then we will speak especially about healthcare management. Healthcare sector actually have the highest salaries. People who work in healthcare in general, they get the highest payment. This is based on a report, which is, I can share the link with you. You can just find it online. And this is also something very nice. When I said I would really love to speak about healthcare management in more particular, I found that also there was another report. This is in the US, which is actually related direct to healthcare management. There was a rise of 28%, and they're projecting from 2021 till 2031. Within this 10 years, they are expecting a raise of 28% in the healthcare management employment and the healthcare managers services itself. So they will estimating that we have a total number of 480,700 number of managers in the US. And by the way, this is also could be a good comparison when it comes to all over the world. You know, the US is a very big country, and the healthcare system is huge there. That means something that we can relate also for the Gulf countries. So if we just look at the percentage, which is most important for us, I think we can relate this, but this is my opinion, we can relate this also for the GCC and the UAE, because we saw now that there's a 12% rise in only in the UAE. I'm expecting that there will be a similar one for the UAE, and this is based, you can see that the resource that I got from, it's the Bureau of Labor Statistics. They did this study, and they're expecting these kind of numbers for the next, within the 10 years. Now, in healthcare, now let's go back to healthcare. So in healthcare, there are some kind of, what we call it, emerging specialization, like some specializations that people would like to dig in more or understand them more. There are so many rules in healthcare management, by the way, and I cannot just put them in these only 6 points, but I'm just mentioning these because people may think it's only, okay, I'm going to be a manager, a coordinator, a supervisor, and I'm going to be planning. No, actually, it's deeper than that. It's more than that. In healthcare management, there's more specialized roles, such as healthcare informatics, which is a very trendy one when it comes to informatics and healthcare systems and how they work. Population of healthcare management in general, there is a lot of, like the statistics we did now, there are the populations for healthcare management and how we are doing the research also for that. Healthcare analytics, this is also trendy now and everyone is going to. I have a student who had studied, and he is actually data analysis and came for healthcare management, and imagine how this will help them to be in the analysis. As I mentioned here, we have that for the data analysis. We have also for technology integration. There's a lot of technology now is going into the healthcare management. I've been in one of the GTEx exhibition here in the UAE, which speaks more about technologies and ITs and all of the, you know, information technologies and cybersecurities, and there is a lot that can be done for technology integration. And if you can visit Google, there is something called Google Health, and this is actually one of the great platform where they use the technology very right to serve people when it comes to healthcare and healthcare management. There is also healthcare policy, which is a policy development. There's a lot of laws and policy and regulation that's been there all over the world, and this is actually an important specialization. When you want to put any kind of policies and law, you can go for this specialization and understand more and work on it actually. The impact now, let's see what is the impact of healthcare reforms. We know that there are so many changes and so many things happen lately, and we will just, I'm just going to speak about these 2 points, and I'm going to give you a very good example to understand what I mean. So the ongoing reform, like if you just imagine how healthcare was in the 18th century, 19th century, 20th century, you will see that everything is different now, and it's not like there was actually there in the 18th and the 19th there was healthcare management and sectors, but it was, of course, at that level. It was developed over the years and over the decades on that. So you will see, like for example, the Egyptians, you will, and in the 18th and the 19th century, the Romanians, and at that time there were so many different civilizations, but they were still actually having their own healthcare system. You know that they had different sewage system, and they have different drugs policies for them. They will use herbs actually to treat people, and they actually have different procedures and technique for women delivery and having, you know, children. They didn't have a vaccination at that time, but they have a prevention techniques. So if you just go back to the history and of how things were before, there are a reform. There is actually a revolution in that. And every time we are starting to change, to reform based on our environment now. We are in a different place, we are in a different position, we're in a different time, and we need to keep up with what's going on. So there will definitely be reform for the whole system. There will be a reform for the policies and it will be changed over the time because of the landscape, because of the time, because of the environment, because of the mentality of people. Now people are more aware now, people are more understanding for their health. So there will be a reform definitely and change. Organizations also are seeking for professional capable navigation. This is actually because of their systems. They have to keep updated now, not just for patients and for health, but for the system itself. It should be updated and it should be following what's going on now all over the world. You have to adapt also for the environment, and you have to implement different strategies now to adapt with the new healthcare and healthcare systems. And this will bring us to the example that I want really everyone to just think about it and see how this reform of healthcare changed. We will never forget what happened during COVID-19 at that time. No one will forget that. An entire system of the universe, the whole universe and the whole world actually changed when COVID-19, when the pandemic hit the world. It was a shock, it was different, it was new. All the policies changed, strategies changed. There was a lot of change at that time. And this is where actually the numbers and the trends for the healthcare systems got up so high, and the demand of healthcare sector was absolutely the maximum in the last 4 years. So the reforming during COVID-19, how it was. Let's start first with the healthcare delivery transformation, how that changed. In COVID-19 pandemic, this has accelerated the adoption of telehealth. You will see that at that time, there was telehealth and virtual care solution. Telehealth mean I'm here, let's say I'm a doctor, you're a patient. We will have an appointment online. We call it a telehealth. Actually, tele, more like just like a telephone. It's a remote one. So there was a lot of adoption now. There was there, but people were not using them a lot. But when COVID hit, there was more of adoption for that technology of telehealth or virtual care and appointment. So there was a lot of appointments going online. There is a lot of consultations, and there is a lot of, the only difference that could be the physical assessment was not available because you could not actually assess a patient touching them during while you have them on a telehealth. So, but there is an adoption for that, and it was very good and effective at that time. Because imagine if I have an appointment and I need to follow up with the doctor for certain things and I can't reach because of the pandemic, everything was shut down and closed, but now you can just do it online. It was a great solution for that. So this is about some kind of adoption for healthcare delivery transformation. Another thing happened, which is the regulation changes for the policies. Government all over the world actually implemented some kind of emergency measurements, just like the one happening in COVID. And they have some kind of policies only for emergencies and regulatory changes. And they change a lot of policy when it comes to critical case, especially for COVID. And they give the priority for those having more severe and critical cases. So they did kind of change for the law and the policies. Financial implications. During COVID-19, everyone got to this financial and economic crisis, actually. And for the healthcare, there was systems, phases that some kind of unprecedented of this financial strain due to the COVID-19 cases. Resources, they were allocated, making them in a different places. There was a lot of revenue loss. When we say revenue, that means people who have business in this sector, actually they lost a lot of money because of the COVID. Their revenue was dropped down to a very, very low. They lost a lot of money, let's say, on that, and there's a lot of resources that we lost because of the different and the financial economic crisis that happened during COVID-19. Workforce resilience and adaptation, which has happened all over the world, not just related to healthcare, but within healthcare management professionals, they played a very important role in coordinating the pandemic response, how they're responding to the case, how they are ensuring safety in the place, and how they are managing the operations and the distribution of the hospitals and the demand. Don't forget also that time there was a high demand for doctors and nurses and all healthcare professionals. How did they manage that? They actually workforce more, and they try to manage the operations better during the COVID-19. And I really wish that will never happen again. Actually, I really wish that COVID-19 would never come again. But I think it was a good thing at the time. And now we are learning now. There was so many things that we learned. We learned some from the mistakes, and we learned actually to adapt for new things. And actually, it helped a lot of countries and everyone actually to be prepared in case this happen again. I think we will handle things much better because we went through all of it. Okay, so this is a general things about healthcare management, and let's see some type of healthcare management that you can actually seek a profession in. You can work in clinical management. Clinical management means you are just organizing and observing, and you are maintaining, let's say, scheduling, supervising within the clinic level, but you are not actually having a direct clinical interaction with the patient, but you are coordinating that. Healthcare consulting, it could be within the consultation of healthcare, any kind of healthcare, maybe policies and strategies. Medical entrepreneurship, you can also work as an entrepreneur in medical sector. Nursing home management, it could be also type of that. Health insurance and underwriting management, which is a very, very great actually sector, and I see a lot of people going to health insurance and policies. Academia, like myself, like if you'd like to be in education and teaching and giving awareness when it comes to healthcare sectors and management, you can work in academia, and also a research. Emergency management, which is also crisis and emergency management, it's a very good trendy sector that you can work in healthcare management. Now, students or everyone who's would like to study in healthcare management, they tell me, okay, what I'm going to do, what are my duties, what I'm going to do if I got a job in healthcare management, what I'm going to do. There's so many things that you can do, but I'm just giving you a few here, it's like just to make you understand what are the very important, interesting things that you can do. You can work in developing organization and goal and objective. You know that in every institution there is organization goals, aims, and objective. You can work in the development for that and for their operational plan. Recruiting, training, and supervising medical staff. This is more related to human resource and HR. Ensuring compliance of patient privacy law and the print of the federal, state, of the local regulation. You can work in law and regulations for that institution, making sure that the institution is compliant for the privacy laws and policy, data protection, and anything related to the governmental regulations. It could be also part of that. Creating work schedule and organizing shifts, for example, organizing meetings and events which is related to healthcare sector, which is related for that particular maybe hospital or clinic. Managing healthcare informatics, including EHR, which is electronic health record. These are the systems that we are using. There's a lot of systems of EHR. This is a general term. There are so many systems that when you go in any hospital, they ask you for your name or for your phone number, when then you put that as in the registration for you. So this is type of healthcare records when they keep all of the information for the patient. It's a very nice systems, and you can work on it. This is more related to information technologies, all the IT systems. It could be included in that. Monitoring and or managing facility finance and budget. If you are interested more in finance, accounting, budget strategies, this is also could be one for you. Communicating with medical staff, department heads, investors, and governing bodies. Could be a PRO in that. You can have a very good communication skills when it comes to communicating with all the medical staff and departments. The last one, you can also identify ways to improve healthcare services and increasing operation efficiency. It could be a great way for you to seek into that word and having an insight when it comes to improving the operation proficiency. Next, it will be a very good thing. I like us also everyone to understand that when it comes to the skills, I really encourage everyone to focus on these soft skills before actually having the technical or the hands-on skills. These kind of skills including decision making. If you are in this sector, it's important for you to understand how to make decisions and how you are going to be in a situation, especially when it comes to laws and regulations, some incident cases that comes to you that requires from you to have a very quick response and having the best decision. It will help you to understand and to know how it's important to have a quick, appropriate, and a concern actually decision at that time. So it's a very good skill that you can take. Time management, which I think all of us need that skills. We need to have better skills when it comes to time management. It's a good way to understand how important time management, especially for healthcare. In healthcare, nothing can be delayed. You know that very well. Nothing can be delayed. We are dealing here with patients, people's lives. So it's very important that we have a quick response and a good time management. We have also another skill, it's stress management. I personally think this is a very important one because you will be, to be honest, in an environment which is full of stress. We are around people. People are sick, people are dying, people are seeking for help, people are seeking for better health and life. So this is a very important skill that you will really learn, that you have to have some kind of stress management in healthcare profession in general. You will learn this flexibility. You'll be flexible for anything. Believe me, you will learn the flexibility. As I mentioned, there's so many aspects for healthcare management. You will be flexible. If you understand the law and regulation, you'll be in that sector. Next, you will go for the strategies and policy development. And then next, you'll be very familiar with everything that comes with the operations. And then you will go with the finance and accounting. It will be very easy to adapt with them, and you'll be very flexible at that. And then that will help you it's very important one to help you to work in teams, teamwork skills. It will help you so much in that. Healthcare management is one of the important, let's say, one of the important sectors that will help you to work in team, because it's a management, and you cannot manage people or manage an operational institution without actually having a team and teamwork. It will definitely help you with the communication. You'll be communicating with everyone, literally with everyone. So it's a great way for you to have some more skills when it comes to communication. Now let's talk about what we offer, what we have, what I'm teaching and what I'm leading actually at GBS. This is the certificate or the diploma, the HND. We have HNC and HND. This is the diploma that we offer. This is the higher nationals of BTech, which is actually coming from Pearson Pearson body, and actually it's based on the UK, and it is a higher national healthcare practice, which is this is the what we offer. This is a program that we offer. I'll speak about that a little bit, and we will dig into the program more. What we offer here, so we offer two levels. Actually, we offer in this qualification, we offer level 4, which we call the HNC, it's a certificate, and we offer level 5, which is an HND, which is a diploma. The level 4, as I mentioned, is a certificate to provide you solid, grounded knowledge of healthcare practice, and you will build up some kind of, it's a basic knowledge for the healthcare sector and healthcare management. HND, which is actually continuous for that, it will be a diploma allowing you to have a further specialized by committing for the special career that you have in a path, or the pathway that you want to progress to, which is, in our case, it's healthcare management. So for that, actually, on the successful completion, when you complete level 5, which is an HND, you will be able to be in the healthcare sector. Either you are entering the employment for maybe first time you are going into healthcare sector, or if you are previously actually in the healthcare sector, you have another certificate in healthcare and you are improving by going into HND for level 5. It will help you with your previous or existing employment. It will help you by linking the appropriate professional bodies with different sectors, committing to for CPDs. It will, if you feel like you need more improvement, and help you with your professional development certificates and stuff. This is also a good way for you. And the most important of those people who will definitely think about progression, if you want to continue after level 5, you will definitely help you to do that. And this will give you a very good idea for what is the progression to other universities, or to universities, or for level seeks a higher level. After completion of level 5 in higher national, which is a H&D, you may be able to go to any path. I'm just giving you some examples. This is not all of them, but we have here some examples for the bachelor's. If you want to go for bachelor's after that, you can go for bachelor's in management studies, health and social care. You can go in health and social care, also bachelor's in general, and the one for management. You can go for health studies, Bachelor of Health Studies. You can go also for adult nursing, public health, and health promotions. And in this case, I will definitely recommend everyone who's thinking about progression to go to, I have a link here which is called Degree Finder for Pearson Qualifications. A degree finder that will help you to put your current degree, let's say H&D level 5, and just find the other universities that will directly give you progression for that. So I would really, really recommend everyone, all the learners that who are looking for the progression, you should always check for the entry requirements for any degree, for any program and any university that you want to go for the progression, because it should actually match whatever we are giving you here for the progression for the next level that you want to take. So based on that, they will definitely have if they are accepting you for the admissions, you should always check for their admission criteria or the entry requirements for them. Some of the examples of the universities that accept Pearson qualification, as they are also offering Pearson qualification H&D. We have so many all over the world. These are some of the examples for the universities and different colleges all over the world, some of them in the UK, some of them in the US, some of them in, we can see here we have in Georgia, we have one I think in Australia. So these are some of the examples: Royal Road, London Metropolitan, University of Dooney, we have University of Portsmouth and Montrose College, Open University in UK, and University of Georgia for Public Health. Examples, these are just all the examples, but of course you can find more if you go to the degree finder of Pearson qualification. You'll find all the universities that are offering the same program, and you can have a progression for level 6 or for the bachelor degree. Now, for employment, for students who like to finish H&C and H&D with us and then seeking for employment, after completing the level 4 and level 3, you will definitely get the chance for employment. And having level 5, actually, it's a very big advantage for that. You can provide the graduates with opportunities for work in different health and social care sector. Most of you will ask me questions about what job title or what career or what particular name of or job actually description where I can go for. I actually found some. These are 22, but actually these are some of them. And if you just go through them, you'll see that you have a lot of opportunity that you can go with after completion of level 5 of healthcare management. You will start with definitely low non-clinical as a low non-clinical managers. You cannot just no one actually just graduate and be a manager, right? You have to start with the low managemental roles until you start build up some kind of skills and experience, and you definitely can be a manager. It could be a health improvement service, case supervisor, patient service supervisor, insurance officer, a healthcare insurance coordinator, medical record supervisor, practice administrator, and healthcare consult supporting services, medical officer manager, health and practice manager, health information manager, clinical cooperation coordinator, healthcare quality improvement coordinator. We have healthcare project coordinator, marketing coordinator, compliance officer, finance analysis, and also for data analysis also can be in there, and for health policy analysis. These are different things. And I found also some, okay, let's go back. I found some resources that is showing some of the salaries here in the UAE and some of the job titles. For example, healthcare administrator, it range from 4,000 to 5,000. You can see also here health and safety, we have 4,000 to 7,000. Medical insurance and medical officers, it could be range from 4,000 to 8,000. It varies. And always remember, that doesn't mean these numbers are accurate, because it depends on previous experience, depends on the location of that clinical site or that healthcare facility. It depends on the requirements for the job. It depends on hours. It depends on also the regulations and the law for that place. So you see that some jobs in Dubai, it's different than Sharjah, different than Abu Dhabi here in the UAE. It differs. It's different. It's not a standard, but just a range. And you can see the resource that I got this from. It's from the glossary and the salary explorer. We got some of the examples for that, and you can just have a look on them, and you can search more in these two resources to find more about these. Now let's talk about the study itself. For level 4, you're going to have to complete 120 credits, and for level 5, you have also 120 credits. Total for level 4 and 5 is 240 credit hours that you have to complete within the 2 years of the program. The good thing about our certificate and diploma, about our program, we don't have exams. I think a lot of students will love that. We don't have quizzes, we don't have exams, you don't have to go and study, come back and write an exam. We have only assignments, and our assignments only having this kind of grading, which is, we just give you pass, merit, and distinction. Pass is the minimum requirement to pass the unit or to pass the course, and we have merit, which is higher than pass, and then we have distinction, which is the highest and exceeding the expectation with the distinction. So we have only assignments. You're going to have write one assignment. This assignment could be a report, could be a presentation, could be like creating a poster, or having a small tiny case study or a research, different kind of assessment we have, but we do not have them as exams or quizzes. You will ask what are the courses or the unit that can be delivered for level 4 and level 5. These are some, we have a total of 14 units. It will be delivered in both level 4 and 5. 7 in level 4, 5 have also 7 sessions, units. And these units, you can see them with different colors, red and green and blue. That means that we have essential, important core unit that should be covered. It's actually, see them in red, the core unit, which is 1, 2, and 3, 4 from level 4, and the 1, 2 from level 5. You have also specialist mandatory courses that should be covered also in healthcare. This is the one in green, and the optional one in the blue. It's actually the one that actually we chose in the center, and we actually believe that is helping more with the sector of healthcare management. So these are the total 14 units. We are delivering 7 units in year 1 for level 4, and other 7 units for year 2 for level 5. And it's very important to understand that we are having 4 semesters in the year. In the academic year, we have 4 semesters. For each semester, we're going to have 2 units. So if you can see here, we have 7 units. So it will be semester 1, 2 units, semester 2, 2 units, semester 3, 2 units, and semester 4 will be only 1 unit, but it's a little bit bigger unit. So this is how the delivery for the units will be, and you can see the names of the units. It may be big names, but it's actually very, very interesting unit and courses that can be delivered within the level 4 and level 5. Then we have something very important that everyone in healthcare management that should understand, that we do actually have something called work placement experience requirements. We are actually going to send you for some kind of observation hours you have to complete in any clinical sites, hospitals, and anything related to healthcare management companies. You have to spend a minimum requirements of 225 in level 4 and 225 in level 5, total of 440 hours in work placement. Or if you previously, or you have already a job or a work that is related to healthcare, that could be also counted in that. But anyway, we are going to offer this for students. It's an observation required for the to complete the level 4 and 5. It's a must for everyone. We will send you to different places to complete these hours. And currently, right now, our students are going through some of the clinical sites, hospitals, and companies. We are sending our students to the Canadian hospital, Saudi, Germany, and Aster, and we are sending them to one of the biggest company here in Dubai. It's the global health bank company. It's a big company, actually, deals with literally healthcare management company with having more than 50 hospital clinics and center under them, and they're doing all the management services for these companies. It gives a great opportunity for the students to understand more about healthcare management. Plus, they're going to go to be explored, have some kind of observation in these different hospitals and clinical sites. A part of the theory that we are going to deliver in the class, there are so many things that students can understand and get from the practical teaching when you go to the hospitals and the clinic. You will have a good experience when you visit hospital. By visiting the hospital and shadowing, you'll understand how things are working. We do case studies within the hospital and in the GBS as in the class. We do a lot of role-playing exercises to make you understand how to do it practically. We do some budgeting and finance management exercises. We do quality improvement projects, information technologies and healthcare exercises, and we actually, I do in my class some kind of virtual hospital exercises, team building and leadership activities, and we do health policy and advocate projects to help you to understand how to develop policies and to understand some cases when it comes to rules and regulations as well. Some people will come and ask, okay, who is actually meant to be in this program? I'll tell you, everyone can be in this program, literally everyone. If you are a school student graduating from high school, you'd like to join healthcare management program, you can do that. Undergraduates who did not complete like different level of bachelor's maybe, or like they have other kind of certificates, they can also join. Postgraduates also have higher certificates, they can also join. Business graduates who would like to specialize in healthcare management, this is a very good way for you. And the best actually for those who are already working in medical and health allied healthcare professions like doctors, nurses, dentists, and technologists, or in any kind of healthcare providing facility, they can definitely also join this program and to be very beneficial for them aside with their certificate. You can also go to the MOH, this is Ministry of Health and Qualifications. You can go for that, and anyone who is in the MOH license and those who are in DHA license, they can join as in potential students for healthcare management. Different workplace, where can I work? You can work in hospitals, you can work in clinic, in healthcare systems, you can work in insurance company, you can work in pharmaceutical and biotechnology companies, you can work in consulting firm, government agency, non-profit organizations, healthcare association and professional organizations. You can work in technology companies, and you can work in academic institutions. Maybe one day you come at GBS and you ask for working as a lecturer or as an instructor. In general, a lot of people will ask me, do we need any license for that? The good thing about healthcare management does not require a license to start working here in the UAE. It will help you if you would like to have a license. These are some of the things that is required from you, but other than healthcare management. So generally, healthcare management does not require any kind of license from you, but if you have any other certificate of health care sector like nurse, doctor, and anything, maybe you would like to go through these and you want to do a license, these are the requirements for you. Here in the UAE, if you are actually not in the UAE or from somewhere else and you would like to explore what are the top healthcare employers here and providers, we have Cleveland Hospitals, Emirates Healthcare Group, Abu Dhabi Service Companies, Dubai Healthcare City, Medclinic, Zuleika Hospital, American Hospital, Saudi German, NMC, Zahra, and Dubai Health Authority. These are the top employers here in the UAE that you can seek some jobs in their places. We'll come to the end now. The call of action will be, I would really encourage everyone to explore more about the educational and professional development opportunities that we can give you here at GBS for as in healthcare management, not just for the HNC and HND, but you also have to seek more about healthcare management because there are so many opportunities can come just from having more explosion of the education and professional development. Always stay informed about the different trends of this industry. Every day there's something new. You have to emerge different technologies and see about the different regulation change that's happening for healthcare management in general. Network with professionals, know more people, connect with people, and ask for mentorship to help you out to understand more and to perceive if you have any kind of interest for job opportunities for healthcare management and healthcare sector. It will be great for you to understand more about this. In conclusion, last thing I would like to say that healthcare management sector holds boundless opportunities. To be honest, it's a really, really great opportunities to join healthcare management sector. For those who are ready to embrace the challenges and reward shipping future for their healthcare profession, you have to seize your opportunity and embrace the fulfilled journey for being a successful career in healthcare management. I really recommend everyone to seek more, seize more, understand more, and ask more about healthcare management, understand it, and just, have some kind of passion to know more about healthcare management. Believe me, you will not regret. This is it for me for today. Thank you very much, everyone, for listening. I'm so sorry. I think I took a
Thank
lot
you
of
very
time.
much. Thank you, Dr.
You're very
Iman.
welcome.
It was a beautiful presentation.
Thank you.
We in fact have a few questions
Sure,
that
sure,
we
absolutely.
have received, that we have in fact received from the attendees of the session. We have also received some questions from YouTube Live, from Facebook Live as well.
All right.
So I
Okay.
would like to ask the questions, and I believe one of the first questions that we had was from Kishore Bandari.
Mhm.
So he mentioned here, in UAE, JCI system, or they have own accreditation standard. He also mentioned another question, IBME, I have done BGDHM. So if I can unmute you, Kishore Bandari, please, and you can ask your question because he's one of the attendees. That will
Okay.
be wonderful.
Yeah, that would be better. I would like to
Yeah,
understand the question better. All right.
of course, of course. So so Kishore, are you able to hear us? Okay, just I was able to unmute you, Kishore. Were you able to ask the question? Okay. So in this, okay. So basically, this was one of the questions. Um, until he unmutes, the next question would be, what is the global opportunity in this sector? What kind of jobs we will be doing, and what would be the base salary structure? Dr. Iman, are you able to hear me? Dr. Iman? Okay.
I think you muted me. That's why I was not able to unmute myself. Can you
Okay.
hear me now?
Yes, I can.
Yeah, actually, I answered all of these questions, but I think maybe some audience or some people came join they joined later. Can you give me the first the questions again? It's about the salaries
Okay, so
and
one, what is the global opportunity in this sector? What kind
mm-hmm,
of jobs we will be doing? What would be
mm-hmm.
the base salary structure?
Okay,
Also, what is the admission fees visa?
okay,
Okay,
all right.
like how to get visa and fees structure.
Okay, so I'll
Yes.
start with the first question, which is what are the opportunities and what are some of the job titles that you can have. First thing, as I mentioned, globally, it can be any kind of the jobs that I mentioned. I mentioned 22 different employment and job opportunities that you can seek in healthcare management. This including, as I mentioned, to be a manager, a non-clinical manager, healthcare improvement services, case supervisors, insurance officers, insurance coordinator, medical records supervisor, practice administrator, consult, healthcare consult. It could be also in policy development. You can also have project coordinator, marketing and compliance coordinator and officers, healthcare services, practice manager. More than 22 job titles. I just mentioned some of them actually, to be honest. There are so many opportunities globally. It can go with all of these different employment and you know different career opportunities when it comes to healthcare management. About the salaries, I gave a small estimation for healthcare management, some of the salaries that you can find. I need everyone, please, to go to these two resources. Actually, it's an online resource. I found this reports in these online resource. Go to glassdoor.com for salaries and Salary Explorer. These are two big, actually, websites online, and they actually offer some of the job opportunities and the average. They give average always for their salary. So I'm going to give you some examples here for salary. We said we have within the UAE. I'm talking here about in UAE, in Dubai. Okay, well, let's say healthcare administrator. The average salary for that is 4,000 up to 5,000 dirham. Okay, this is UAE dirham. And then we have healthcare assistants from 5,000 to 9,000. We have insurance officers starting from 6,000, and you can just go up to 24,000 dirham. So, and we have also, I'm giving another example, we have healthcare project manager. It starts from 13,000. I am just giving these examples, and I mentioned very clearly that these are not actual. I cannot give you a direct actual number and I'm telling you this is the salary that you're going to get when you graduate. Absolutely not, because this is based on their experience, if you have experience or not. So someone who just graduate and enter the market, you cannot have a 20,000 salary, of course not, but you will have an entry level. You will go within the entry level. So it's based on the experience. The more experience you have, the more salary you'll get. It's based also on the region and the country. Like in the US, I get maybe higher than the UAE. We don't know. Maybe I'm just giving example. Maybe in Africa, they're giving more than Asia. It depends on the region and the environment and the country and where are you actually with healthcare system that you are being provided to. So it depends also on the qualification. Maybe you have a previous qualification plus healthcare management. That will give you more advantage to that, right? So it depends. I cannot tell you exactly the salaries, but I can give you an average, just an average of how some of the titles or some of these jobs can have different opportunities and different salaries. She asked about the admissions also. I think this is a part that you can take, Amr.
Yes, of course.
Yeah.
Besides this part, there was a few questions actually that I believe you would be the best person to speak to, and then
Tell
after
me.
that, I'm going
Sure.
to cover the other parts. So,
Okay.
what is this? This was actually from Facebook Live. Is the new skill will be most valuable for future healthcare professionals?
I'll tell you, this is a very good question. Whoever said that, this is a very good question. I think the most important skill that you can take from healthcare management, two skills. Basically, I cannot tell you one, it's two skills: critical thinking and decision making. You are in a very critical place, to be honest. So you have to think critically how you're going to face a lot of problems, especially when it comes with patients are, you have to treat them with empathy, with humanity. I mean people are coming to you to seek for help. So in some cases and situations, you have to have the best way to solve problems and to have the fast critical thinking and to give the best solutions for both of you, the patient and for you as in healthcare managers or in this sector. And the decision making, that's why I said these two are together. Critical thinking, it's how also quick you respond and how you are going to make the best decision. I will definitely say these two skills, critical thinking and decision making, will be the greatest skills that you can get when you be in this sector of healthcare management.
Amazing, 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 Dr. Iman. Another last question. The same question, but in terms of specialty. What would be a niche specialty or career path within the healthcare sector that individuals might not be aware of, but is worth exploring?
Can you say it again? Because I missed the first part.
Okay, so it's basically the career path or specialty
Mm-hmm.
within the healthcare sector that
Okay.
individuals might not be aware of, but are
Okay.
worth exploring.
Okay, healthcare management. Simply healthcare management. I'll tell you why. As I mentioned in the beginning, there are so many places that you can go with healthcare sector. If we say healthcare sector, you can be a doctor, you can be a nurse, you can be a nutritionist, you can be a technologist and lab technologist, medical imaging technologist, physiotherapist. So many. But to be honest, everyone's eyes now on healthcare management. Because if you just go back to COVID, and I just mentioned that in the presentation, go back to COVID and see what happened. People were crazy. Yes, we have doctors and nurses and everyone is there, but there was a true problem when it comes to policy, regulation, coordination, management for the crisis. The crisis was too big to handle by everyone, and we needed a lot of skills that is related to healthcare management. This sector, I'm telling you, it's not new, but people really do not focus and explore and have their eyes on that. So I really recommend everyone to explore more. That's what I said at the end of the presentation. Explore more about healthcare management. This is the one people do not actually, I'm not going to say not taking it seriously, but I think they are just blinded away a little bit by the other sectors. I want to be a doctor, I want to be a nurse. Be a healthcare manager. I think that's the best opportunity for everyone who is exploring something different and new in healthcare sector.
Wow, Dr. Iman, I got excited as well.
You come and join me.
Honestly speaking, it is a really great program that I believe in.
Yes.
Thank you very much for all this explanation. Thank you. All right, so the next question would be admissions, visa, and fees. So basically, and what is the admission process? So if you are a high school student or if you are a working professional, what we need is your latest educational qualification, all right? And then obviously along with the standard documents like your passport, ID, all this for personal verification. And then after receiving your latest educational qualification, along with some English proficiency, otherwise we can do it internally, we can do an internal assessment, okay? And then it's going to go through a process, which is the admissions, or I would say a committee that will be evaluating your documents. Once the documents are evaluated, we'll definitely be getting back to you for feedback whether you're accepted in the program or not. Hopefully, you will be accepted as long as you have your high school transcripts ready, or otherwise, if you're a working professional, or if you are a doctor, or if you were in the top management in a healthcare facility, or if you were a nurse and you want to upgrade yourself. So all these options are available and are valid in healthcare management. So whether in high school or whether as a working professional in the healthcare facility, we are more than happy to take all your requirements and for you to join our program. In terms of the fees, so it's basically 40,000 dirhams AED, okay, a year. However, at the moment, the good news is for June intake and for the September intake, we're having a 50% scholarship. So with that, it goes down to from 40,000 to 20,000 dirhams a year for the first year. For the second year, level 5, that will be depending on your academic
Performance.
performance. Exactly. So in terms of the visa, I've got a question as well here about the visa. So once you're accepted and once we issue you an offer letter, that's when we will start with the visa process. The visa process for international students, it's 5,000 dirhams. For local students who wants to have a 1-year student visa as well, it's for 6,000 dirhams AED. All right. So once you receive offer letter, then you can make transaction for your tuition fees along with your visa fees in order to start your process. Now, about the fee structure, I think I have already, I think it was clear. I submitted my form, but what about admission procedure? We were able to answer the question as well. One last question from YouTube Live. It mentions here, am I able to do this as a part-time course? Now, this is the beauty of healthcare management. This is the beauty of what we are offering. So while working, you can also continue your program. So yes, it can be classified as a part-time program for working professionals. I believe, Dr. Iman, we were able to cover all the questions.
Yeah, I'm very interested also for some information that I really know from you that they have a discount. This is great for the scholarship. It's amazing, and I really want to ensure, to be honest, literally everyone can join this program. I have in my class those who graduated from school last year and they just got into the program. I have doctors in my class. I have nurses. I have dentists. I have physiotherapists. I have others students who with experience or without the experience. They all can join the program, to be honest. And it's a great opportunity for both of them. For those who are joining for the first time, they don't have any previous experience or healthcare certificate before, it's good to explore the program. And those who already are in there in the sector, they have a certificate or they have been working in hospitals before, it's a great opportunity to know. You just keep updating and developing yourself and have a nice certificate, and it will be looking beautiful in your CV, by the way. So literally everyone can join. I have multiple different levels of my students in my class. And the question of being a part-time, this is a great thing about healthcare management program at GBS, that they can actually uh, I have a lot of students actually coming into class and at the same time having a part-time program, and they have another job. So we do help them with that. Most of my students, they're doing that. They have a job, plus they are coming into class. My only condition with them is like, you have to come to my class. That's the only condition. It's the one day that you have to come to my class. That's it. Yeah, I can't hear you, I think you're muted.
Am I audible now?
Yes.
Okay. For some reason, it goes back and forth. So
Yeah, it's okay now.
thank you very much. Okay, so basically, last but not least, guys, for everyone who was watching us on YouTube, who's watching us on Facebook, and who is also with us here in the session, we have a virtual tour that you can also go through to see the campus, to see where we are. Okay, and we would like, on behalf of Dr. Iman, on behalf of GBS family, we would like to invite you all for the open day next week, hopefully on Saturday. So it's going to be on the 18th of May. All right. So we would like to invite you. It's going to be from 2 o'clock to 4 o'clock. Or from 2 to 5. We would like to invite you all to visit our campus, explore it, speak to our admissions team, meet us, meet Dr. Iman, meet the faculty, and explore more. We would like to thank you very much for attending the session. Is there any final words, Dr. Iman, would you like to add?
no, thank you very much. That was a very nice session. Thank you for everyone. I don't know everyone on YouTube and Facebook, everyone. Thank you for joining us. Thank you for attending. I hope I was able to give you an insight for healthcare management, our program here at GBS. And I wish to see you again in future sessions. Wishing you all the best and have a lovely weekend.
Thank you very much, Dr. Iman, for your time.
Thank
It
you.
was an amazing presentation.
Thank
And
you. Thank
for
you very
all the
much.
audience, have a wonderful day and looking forward to welcome you all. See you. Thank you very much.
Thank you all.
Bye.
Bye.
Thank you.
Bye-bye.
Bye.
Thank you very much. Thank you. Bye-bye.